Hello and welcome to Askimo TV. I'm talking today to Dr. Bruce Okoye. Dr. Okoye is a consultant paediatric surgeon at St. George's Hospital in London, the Royal Marsden Hospital, and the Portland Hospital for Women and Children. He specializes in all aspects of pediatric surgery, but particularly in surgery for childhood tumors. Hi, Dr. Okoye, how are you?
Very well. Good morning, Joanne. How are you?
Very well, thank you. Dr. Okoye, today we're going to talk about pediatric tumors, the teratoma. So let's begin with, what is a teratoma?
It's a tumor, most often a benign tumor, but can also be a malignant tumor, which consists of, it's a very interesting tumor in that it consists of primitive cells of the embryo, which should have gone on to develop normal structures in the body like skin or bone or brain, but instead come together to form a lump or a tumor, which consists of cell types of all the developing aspects of the embryo. So if you were to cut open a teratoma, sometimes we may see bits of hair or bits of bone or bits of brain within the tumor at varying stages of development. So they are quite an interesting group of tumors.
What causes a teratoma and who is at risk?
We don't really know what causes teratomas, unfortunately, and nobody's particularly at risk. It is slightly more common. It is commoner in girls than it is in boys. But there are no particular predisposing factors to this.
What are some of the signs and symptoms of a teratoma?
Teratomas have quite interesting because they can present in a very wide range of sites. Most commonly, they present in the gonadal areas, so in the ovaries in a girl, or in the testicle in a boy, but they can also present as a big mass in the abdomen and sometimes in the chest. So the presentation is quite varied. Often we're able to pick up some types of teratomas, in particular one called a sacrococcygeal teratoma, which is a lump on a teratoma on the back around the buttocks. And we can pick these up before the baby is born. When we pick these up before the baby is born on antenatal ultrasound scanning, then we can arrange early treatment. Quite often girls, teenage girls, or sometimes younger, will present with severe abdominal pain because the teratoma arising in the ovary has twisted, or there has been a bleed into the tumor, and they present with abdominal pain, and we discover them acutely when they present through the accident department. Or sometimes they may just present with a large lump in the belly, or if the tumor is arising in the chest, they may present with shortness of breath, for example, and then the tumor is subsequently discovered.
How are the tumors diagnosed and what treatment options are available?
Tumors are very often diagnosed, first of all, with a good clinical suspicion. So some of them are quite characteristic. For instance, the sacrococcygeal teratoma, which I mentioned, occurring in babies, has quite a classic appearance. You look at it and you know exactly what it is. With the other ones, again, imaging by way of ultrasound scan or CT scan is often the best way to make the diagnosis. Teratomas fall within a group of tumors called germ cell tumors. And so these tumors sometimes release certain chemicals or hormones that we can measure in the blood. And again, that can be diagnostic. Sometimes we need to biopsy the tumor, but often biopsying or taking a piece of tissue is not possible because very often these tumors are quite cystic or full of fluid, and so sometimes it's not easy to get solid tissue to send off to the lab.
What treatment options are available to help children with these conditions?
Well, this is one tumor for which surgery plays a very, very vital role. Of course, no children with any tumor should be managed outside of a multidisciplinary team consisting of oncologists, surgeons, radiologists, nurses, because most of these tumors these days are managed according to national and international protocols. But by and large, teratomas most often can be treated by surgery, by removing the tumor completely, and very often that is the only treatment that is needed. But sometimes these tumors can be malignant and can have spread to distal sites, and therefore need additional chemotherapy.
What is the prognosis for recovery with this tumor?
In general, the prognosis is in excess of 80%. The prognosis is very good, provided it is picked up early and removed completely. Even for children who have malignant germ cell tumors, the prognosis is quite good, and they tend to be quite sensitive to chemotherapy. So the key is early diagnosis, but the outlook tends to be quite good for these children.
And just to end off, what is the recommended long-term care for children treated for a teratoma? What is the recommended long-term care for children treated for a teratoma?
Yes, children who've had a teratoma removed by surgery, again, need to have long-term follow-up. But we're quite fortunate in that with children who've had teratomas, if they recur, if you remove a benign teratoma, unfortunately, when they recur, they tend to recur as a malignant tumor. But those tumors tend to secrete hormones, which we can measure in the blood. So we usually follow up these children for at least 3 years, usually just with blood tests. And if there's any sign of recurrence of the tumor, that is often reflected first in a rise in these, what we call tumor markers or hormones, which we can pick up on a blood test.
Thank you, Dr. Okoye. Thank you so much for talking to me today.
Thank you.